Is your face showing the signs of aging? Sunken in cheeks, lines between the nose and mouth, and even forehead wrinkles can make you look older than you actually are. One option for restoring a youthful appearance is fat grafting. Here to tell us more about it is Dr. Beth Collins, a double board certified plastic and reconstructive surgeon with a practice in Guilford. Dr. Collins, thanks so much for being here.
Hi, good to see you again.
First, let's start off. Tell me about your practice.
Well, I have a practice in Guilford. I do surgeries along in the Yale Hospital, so I do a lot of focus on cosmetic surgery and some reconstructive breast surgery, but I think we're here today to talk about the cosmetic aspect of
the fat grafting. This sounds pretty incredible. So basically, you could take fat from where you don't want it and put it into your face?
Yes,
that's
precisely.
Awesome.
Yeah. So fat grafting has been used a lot in all sorts of branches of medicine, but the nice thing about it is you could take it from your belly if you have a little bit extra there, your flanks, your thigh, whatever it is, and you could inject it into areas where you're deficient. And part of the signs of aging in your face is loss of volume. So we do some of that replacement of volume with commercially available fillers, but you can actually do it with your own fat.
Is it safer that way?
I don't know if I'd call it safer. It's just a little bit different.
Okay.
So when you put the fat in, you have to put it in little aliquot, little layers, and then it sets up and takes as a graft. So the portion of it that takes is permanent.
Wow.
Occasionally you have to come back and do a couple of treatments. So it may take 1 or 2 times going back to do a fat grafting procedure. But once you get to your final result, you know that that's going to last, and you've restored that facial volume permanently. So it's a little bit, a little bit more invasive than the commercial fillers, but then again, you may not have to keep doing it.
And it lasts forever. That's great. Is it a painful experience or not so much?
No, it's not painful at all, actually. I do it in my office.
Oh, so you don't even have to go to the hospital or anything?
No, you don't. I could do local anesthesia just in some areas on the face, and then it's completely painless.
Wow. All right, well, we have to look at the before and after pictures because these are really impressive. Doctor, just tell us what we're looking at here.
So this is a lady I did actually last week, and her before picture is there. In her after picture, that is 2 minutes after her procedure.
Oh my goodness. And you can see the results already.
Absolutely, yeah, and I wanted to show that because there she is, wide awake, and the result is instant, not a whole lot of swelling. People ask me what the downtime is. The downside to this is you can get some bruising, but it's not terribly common, and there she is. She had a tiny bit of bruising, but you can't even really see it.
She could go back to work if she wanted to.
Absolutely, and she actually went away the next. She's going away today. I think
wow.
She's
New look.
just ready to go.
And then there's 2 more. Wow, that's dramatic.
Yes. So
I mean, you could see kind of the thinning underneath her eyes, right?
Absolutely. The nice thing is sometimes you see those dark rings under your eyes, and that is sometimes from pigmentation of the skin, but most of the time it's actually from shadowing, from losing volume. So if you replace that volume, those shadows and those deep circles go away. So that's really changed this lady, and subtly.
It takes years off your life, though, it seems like, right?
Absolutely.
Or your age, at least. Not your life. All right, let's look at the last one.
But yeah, and so here's another lady, same problem. Now, in this lady, I did a little bit more, because you can combine this procedure with others.
Okay.
In this particular lady, she had some extra skin as well as the shadowing. So I did a lower lid blepharoplasty, and just augmented that with a little fat grafting, and I think really transformed her. She looks like
it's like 2 different people.
Yeah, it is. I mean, you're still going to look like yourself,
right,
and
so
natural, but it is. It really does change the way you are for the better, I think.
Yeah, absolutely. And I think it's fantastic. You can go right to your office and do it.
Absolutely.
That's great.
Yeah.
All right, Dr. Collins, thanks so much for all the information.
Yeah.
Let's put it up on the screen. If you're interested about fat grafting, you could just call Dr. Collins at 203-689-5295 or visit BethCollinsMD.com. Again, thanks for all the info.
Thank you.
All right, up next, Neil Fuentes. And Neil Fuentes is over in the kitchen. No Billy today, but first, take a look at this.